Hi, so our next topic is subconjunctival hemorrhage. Ecchymosis of conjunctiva or subconjunctival hemorrhage. Subconjunctival hemorrhage is also known as ecchymosis of conjunctiva. So it is very common occurrence and it may vary in extent from a small petechial hemorrhage to an extensive one spreading under the whole of the bulbar conjunctiva and thus making the wide sclera of the eye invisible. So it can extend it from the subconjunctival hemorrhage can extend from small petechial hemorrhage. Petechial hemorrhage, you know, right? The small dot like hemorrhage. So it can extend from a small petechial hemorrhage to an extensive one spreading under the whole of the bulbar conjunctiva. So this is the bulbar conjunctiva which is exposed. So it can spread to that whole bulbar conjunctiva and thus making the wide sclera of the eye invisible. And because of this condition draws the attention of the patient immediately as an emergency. So because of this, it will spread to the whole sclera, becoming invisible. So if it comes like that, the patient will get panic and the patient will think it as an emergency, but is most of the time trivial. So most of this time it is not an emergency or it's of little importance. But by seeing the condition, the patient will get panic and it will become, the patient will think it as an emergency. So here you can see this is how the subconjunctival hemorrhage looks like. It can start like this. In some patients we can see subconjunctival hemorrhage like this, like a small dot, or like a petechial hemorrhage. Petechial hemorrhage means small dots. You can see a lot of dots will be seen here. Or it will extend to the full bulbar conjunctiva like this, making the wide sclera of the eye invisible. So this is how the subconjunctival hemorrhage looks like. So etiology, causes for subconjunctival hemorrhages, it may associated with the following condition. That first one is trauma. So it is the most common cause of subconjunctival hemorrhage. It may be in the form of local trauma to the conjunctiva, including that due to surgery and subconjunctival injections. So first one in trauma, the first one is local trauma to the conjunctiva, including that due to surgery. It may be due to surgery or due to subconjunctival injections also. And second one is retrobulbar hemorrhage, which almost immediately spread below the bulbar conjunctiva. So the second one is retrobulbar hemorrhage, which can spread immediately under the bulbar conjunctiva. Mostly it results from retrobulbar injections. So mainly in anesthesia, in the ocular surgeries, during anesthesia, giving anesthesia, we will give in the retrobulbar injections, and maybe because of that there will be hemorrhage and it will spread below the bulbar conjunctiva, and from trauma involving various walls of the orbit, or any trauma to the walls of the orbit. Because of the trauma in the orbit, there will be subconjunctival hemorrhage. So in the cause, the first one is trauma. That can be a local trauma or through the retrobulbar hemorrhage. So in a local trauma, it may be due to any surgery or due to the subconjunctival injections. But in the retrobulbar hemorrhage, it is mostly due to retrobulbar injections or due to the trauma involving various walls of the orbit. So here you can see like this, they used to give the retrobulbar injection. Okay, retro means behind. So you can see here, this is the eyeball. So behind that, they used to give retrobulbar injections. Because of that, if there is a trauma, it will get collected under the bulbar conjunctiva and it leads to the subconjunctival hemorrhage. Or else the walls of the any injury to the walls of the orbit can also leads to subconjunctival hemorrhage. So this is about the trauma. Second cause is inflammations of conjunctiva. Inflammations of conjunctiva can be said as conjunctivitis. So, petechial subconjunctival hemorrhages are usually associated with acute hemorrhagic conjunctivitis. So, this acute hemorrhagic conjunctivitis may cause petechial subconjunctival hemorrhage. Acute hemorrhagic conjunctivitis is caused by picornavirus, pneumococcal conjunctivitis and leptospirosis, icterohemorrhagica conjunctivitis. So, because of all these, there will be acute hemorrhagic conjunctivitis which will cause petechial subconjunctival hemorrhages. It looks like this. This is the petechial subconjunctival hemorrhage. So first one was trauma, second one was inflammations of conjunctiva, that means conjunctivitis. Next, third one is sudden venous congestion of head. Sudden venous congestion of head. It is seen in, it mainly occur due to rupture of conjunctival capillaries due to sudden rise in pressure. Due to the sudden rise in pressure, the conjunctival capillaries get ruptured. So, common conditions for this are whooping cough, epileptic fits, strangulations or compression of jugular veins, and violent compression of thorax and abdomen as seen in crush injuries. So, mainly it is due to whooping coughs. Because of whooping coughs or epilepsy, epileptic fits or strangulations and compression of jugular vein. The jugular veins, you know, right? It is here. So, because of these strangulations or compression of jugular vein and violent compression of thorax and abdomen as seen in crush injuries. So, in car accident and all, there will be a violent compression in the thoracic and abdomen region. At that time also the pressure to the head increases and there will be rupture of conjunctival capillaries. So that is sudden venous congestion of head. Fourth one is spontaneous rupture of fragile capillaries. Spontaneous rupture of fragile capillaries, it occurs in vascular diseases such as arteriosclerosis, hypertension and diabetes mellitus. So, it can be seen in diseases like arteriosclerosis, hypertension and diabetes mellitus. There will be spontaneous rupture of fragile capillaries. Local vascular anomalies like vascular anomalies, diseases in the blood vessels, telangiectasia, varicosities, aneurysm or angiomatous tumor. In all these vascular anomalies, there will be subconjunctival hemorrhage. So, telangiectasia, vascular varicosities, aneurysm or angiomatous tumor. In this condition also there will be subconjunctival hemorrhage. So that is local vascular anomalies. And the sixth one is blood dyscrasias. So blood dyscrasias like anemia, leukemia, dysproteinemias, all these conditions also there will be subconjunctival hemorrhage. Bleeding disorders like purpura, haemophilia and scurvy. So in bleeding disorders also we can see subconjunctival hemorrhage. And the eighth one is acute febrile systemic infections. Febrile means just fever is there. Acute febrile systemic infections such as malaria, typhoid, diphtheria, meningococcal septicemia, measles and scarlet fever. In these all conditions also there will be subconjunctival hemorrhage. So malaria, typhoid, diphtheria, all these fever conditions also there will be, along with this fever there will be subconjunctival hemorrhage. And the last one is vicarious bleeding associated with menstruation. It's an extremely rare cause of subconjunctival hemorrhage. So in case of menstruation, okay, all these are the causes for subconjunctival hemorrhage. So which all are the causes? There will be because of the trauma that is direct to the conjunctiva or associated with the conjunctivitis, inflammation of conjunctiva, or due to vascular diseases, or due to fragile capillaries, or due to bleeding disorders and febrile systemic disorders, or along with the menstruation. All these conditions it will be get associated with subconjunctival hemorrhage. So these are the causes for subconjunctival hemorrhage. Next comes the clinical features. Subconjunctival hemorrhage is symptomless. There won't be any symptom for subconjunctival hemorrhage. Only you can see that hemorrhage. But if it is associated with other diseases, that symptoms will be there. So however, there may be symptoms of associated causative diseases. On examination, subconjunctival hemorrhage looks as a flat sheet of homogeneous bright red color with well-defined limits. So you can see a well-defined border, and it is a flat sheet, flat, shining, homogeneous bright red color. So evenly spread, bright red color with a well-defined limit. So with a well-defined margin. That is how the subconjunctival hemorrhage looks like. In traumatic subconjunctival hemorrhage, posterior limit is visible when it is due to local trauma to eyeball, and not visible when it is due to head injury or due to the injury of the orbit. So, in traumatic, due to the trauma, if it is a traumatic subconjunctival hemorrhage, the posterior limit is visible if it is due to the local trauma to the eyeball, and not visible when it is due to any head injury or injury to the walls of the orbit. Most of the time it is absorbed completely within 7 to 21 days by itself. Okay, most of the time it will absorb by itself. During absorption, color changes are noted from bright red to orange and then to yellow. First, it is told as a bright red homogeneous, well-defined limits you can see in scleral region. But during absorption, that bright red will first change into orange and then into yellow, and it will get absorbed completely. In severe cases, some pigmentation may be left behind after absorption. If it is a severe case, then little bit discoloration will be there in that area, but nothing to worry. So these are the clinical features. So clinical features, it's a symptomless, but what disease is associated with that symptoms you can see. It can be seen as a with a well-defined margin, bright red color, that is also flat, not elevated. It's a flat and shiny. And in traumatic subconjunctival hemorrhage, we can see the posterior limit. If it is it is a local trauma to the eyeball. If it is due to the trauma due to the head injury or due to the injury of the wall of the orbit, then posterior limit cannot be seen. And most of the time it will absorb itself within 7 to 21 days. The changes we can see, first the bright red color change to orange and then to yellow, and it will get absorbed. But in severe cases, the absorption won't be complete, and there is a little stain can be seen there. So this is the clinical features. Next comes the treatment. Treat the cause when discovered. What is the associated disease or associative causative factors? We have to treat that. Placebo therapy with astringent eye drops, because we told already it will get absorbed by itself, but the patient will get scared by seeing this. Patient will get panic, so we have to give something. So they used to give astringent eye drops. Psychotherapy and assurance to the patient is the most important part of the treatment. So give assurance to the patient that it will get absorbed by itself. Cold compress to check the bleeding in the initial stage. In the initial stage, we can give cold compress so that the bleeding will get stopped. After that, we have to give hot compress. It will help the absorption of blood in the later stages. So these are the treatments for subconjunctival hemorrhage. So first we have to give the treatment for the underlying cause, then placebo treatment can be given, and the main thing is assurance to the patient. And we can give cold compression to check the bleeding, to stop the bleeding, and hot compression for the absorption of the blood in the late stages. So that is about a subconjunctival hemorrhage. So it may be due to blood vessel related diseases or due to the trauma, subconjunctival hemorrhages, and it is without any symptoms. So it will there is no treatment actually required. It will get absorbed by itself in within 7 to 21 days. So that's about subconjunctival hemorrhage. Hope you understood subconjunctival hemorrhage. So thank you. Have a nice day.